Hello, Facebook. This is Siddharth Tambar from Chicago Arthritis and Regenerative Medicine, where we specialize in musculoskeletal health and wellness with a particular focus on utilizing the most up-to-date treatments available for arthritis, tendinitis, injuries, and back pain. So this is the first Facebook Live event that I am putting on in what I'm hoping is meant to be a more regular occurrence. In the past, I've done 2 different Facebook Lives in the setting of a podcast interview, and today is something meant to be a little bit different. There are so many interesting topics when it comes to your musculoskeletal health. I think it's super beneficial for all of us to discuss them, and I think it's really helpful for me to get feedback and hear what people are interested in hearing about and what are more interesting things that you'd like to hear about. In the field of musculoskeletal medicine, we are really entering a pretty exciting and interesting moment where, because of some of the treatments that are available in the regenerative medicine space, there's a lot of more interesting and beneficial things we can do for people that have arthritis, tendinitis, injuries, and back pain. So in thinking about what would be a good first topic to kick this series off, I picked 2 really common things. Number 1 is knee pain, which 70% of people in the world will have at one point, and utilizing the treatment platelet-rich plasma, which is a really common first-line treatment for people that have failed conservative measures for their knee pain, and is a really key building block when it comes to regenerative medicine. So let's get into it. Platelet-rich plasma, what is it? So in really the most basic definition of what is platelet-rich plasma is essentially taking a sample of your own blood, concentrating it so that the level of your platelets and what's remaining is higher than what you normally have in your blood. That's really it. Now, from a clinical and medical standpoint, it really matters how much higher you go. It makes a big difference in terms of outcome and the kind of things you can treat. But as a really kind of basic understanding, platelet-rich plasma is a higher concentration of platelets. And that's important to understand because in the medical literature, there's a lot of good evidence of the efficacy of platelet-rich plasma when it comes to knee problems, in particular knee arthritis. But the reality is that even in the medical literature, how they define platelet-rich plasma, whether based on concentration, red blood cells, no red blood cells, white blood cells, no white blood cells, is not always as well defined as it should be. And part of what I'll talk about a little bit later is things that you should know about how your platelet-rich plasma is being created that makes a difference in terms of the kind of outcome and treatment that you receive and the efficacy of it as well. Because the reality is that you may have a type of platelet-rich plasma that has a lot of red blood cells that's more inflammatory, or you may have a type of platelet-rich plasma that is just high in platelets, and that results in different kinds of outcomes. I think before we get to that, and I'm going to talk more about specific knee problems that I think are really great examples of how to utilize platelet-rich plasma, I want to first go through some very key principles when it comes to how you utilize platelet-rich plasma and just regenerative medicine in general. I very strongly believe that when it comes to musculoskeletal medicine, there are really 2 key pillars that we can improve things on and that are very key variables when it comes to how you'll actually do when it comes to treatment and how you're experiencing pain and your dysfunction. And those two key pillars are inflammation and instability. So inflammation is very interesting because there is chronic inflammation and there's acute inflammation. And these are very different phenomenon, and they have very different effects to the body. Acute inflammation is helpful for the body. So as an example, if you sprain your ankle, you'll get a swollen ankle. That is acute inflammation. That is your body bringing in cells to help heal and optimize that injured tissue. So we utilize regenerative medicine treatments like platelet-rich plasma to help kick off that healing process by harnessing the positive beneficial effects of acute inflammation. Platelets work in an acute setting. Essentially, after you've had an injury, you have platelets that get brought in to help kickstart and coordinate that healing process. So the growth factors that come out from the platelets do a couple different things. Number one, they help to stimulate your own local mesenchymal stem cells that are essentially within the joint and any tissue that you have in the body, help to stimulate them, to kickstart them, to then coordinate the overall healing cascade. Number two, the growth factors from the platelets draw in other cytokines, cells, and growth factors that you need to basically help start that healing process. So platelet-rich plasma works based on utilizing that acute healing process. If you can do that in a very fine and targeted manner, that can be very beneficial. On the other hand, chronic inflammation is a problem. Chronic inflammation is essentially your body's inefficient, ineffective, and mistaken way of trying to deal with damaged tissue and stress. And an example of that would be if you have chronic swelling in your knee. That's essentially chronic inflammation. And number one, just because it's taking up room, that can cause pain and restriction in range of motion and thus restriction in function. In addition, that chronic inflammation is not healthy for the joint. It'll cause damage in the joint. So a large part of how regenerative medicine works is by resetting that chronic inflammation within the joint and by optimizing it and putting the joint into a healthier state so that you have less pain and better function as well. So inflammation is a really key pillar to musculoskeletal medicine, and it's something that platelet-rich plasma is very effective at improving. Number two is instability. Instability is another really key principle in musculoskeletal medicine. And the reason why is because as your body is going through a range of motion, as your body is going through the normal work and process and load that it needs to tolerate, it needs to have a certain amount of stability. Without that stability, you can't go through that range of motion in a safe manner. You can't go through it without pain, and you can't go through it without losing control and strength. So stability is key. And that stability is held together by an entire coordinated functional unit. So in the knee, for example, there's layers and layers of that tissue, which we'll talk about in a moment. The regenerative medicine treatments work in large part by helping to improve that stability. The original regenerative medicine treatment was prolotherapy, and that worked by strengthening the ligaments by creating acute inflammation. Platelet-rich plasma does a better job of that. And by strengthening the soft tissue, including ligaments, tendons, and other soft tissue structures, it improves stability. Improving stability then in turn reduces pain, reduces chronic inflammation, gives you better control and a stable joint, and improves your function as well. So stability is incredibly key when it comes to musculoskeletal care and is something that can get better as well. The third issue is with these kind of treatments that it's very important to have a personalized approach to treatment. And by that I mean Just because one person has knee pain does not mean their knee pain is the same as somebody else's knee pain. You have to look at this in a personalized manner, whether it's what's your pathology. Not only do you have knee arthritis or a knee tendon injury or knee ligamentous injury, what are the other factors involved? What are the other pathology that's involved in the joint? What are the issues above and below the joint as well that are problematic? You have to look at this in a more nuanced and detailed manner because it makes a difference. Your knee problem is not the same as somebody else's. A one-size-fits-all approach will not give you a good result. It's not fair to you, and it's not the right way to do this either. In addition, that makes a difference because you can't utilize a one-size-fits-all platelet-rich plasma either. If your issue is predominantly knee arthritis, you'll use one concentration of platelets. If your issue is more of a tendon or ligamentous injury, you'll use a different type of platelets. And in fact, if you have a nerve or ligamentous injury, you might actually use something called platelet lysate, which is another type of platelet product where you just take the growth factors from the platelets directly because it's less inflammatory. So a personalized approach makes a big difference. And if you then also consider that, what are the other systemic issues that you have? Are you a diabetic? Do you have metabolic syndrome? Do you have an autoimmune condition? Do you have something else that's driving inflammation or instability? That makes a difference in terms of how you need to be treated. You can only really do that if you have a flexible lab approach when it comes to treatment in the office. If you don't, it makes it hard to have that kind of personalized approach. The next issue is image guidance. The old school way of trying to inject a joint or a tendon was you essentially sort of felt the surface anatomy with your hands and you sort of inserted a needle hoping to hit the right spot, never really being sure if you hit the right spot, and that was it. The tools that have been available for over 20 years now include high-level ultrasound and x-ray guidance. As a physician, if you're not utilizing that, you're not doing right by your patient. It's not good enough to be utilizing the best techniques from the 1970s for your patients. You have to be utilizing what's available. It would be like trying to examine a person that has a heart problem with just cupping your ear to their chest instead of using a stethoscope. You have to utilize the tools that are available, and it makes a difference because if I want to inject someone that has a ligamentous injury, I need to use very fine tools to do that. I need to hit the spot that is down to the sub-millimeter level. I can't do that without utilizing ultrasound and x-ray guidance. Until I actually have x-ray vision, I need to utilize the tools that are available. So that's very important. And if your physician isn't utilizing that, you need to ask why, and are they going to get the right kind of outcome for you? The next issue is this concept of layers and depth of treatment. I think this is so essential to understand how you can get a good outcome with regenerative medicine. And important because when you look at something like knee pain, the old school way of looking at knee arthritis, for example, was they would take an x-ray, pop it up on an x-ray board in the doctor's office, and your doctor would point at the x-ray and say, look at that. You've got bone-on-bone arthritis. You've got degeneration there. That's your problem. What's funny is that's actually how probably 95% of doctors still look at knee arthritis. But that's not good enough. The reality is when you look at pathology in the knee, it's a lot more layered than that. As an example, if you have knee arthritis, it's not just that you have breakdown of the cartilage or stress in the bone. It's that the meniscus has been chronically degenerated. Above that, you'll have a collateral ligament, medial collateral ligament, that's been chronically strained as well. Above that, you'll have tendons that have been chronically strained as well. Above that, you'll have fascial layers and peripheral nerves that have been chronically stressed as well. Every single one of those layers and levels is driving pain. Every single one of those layers can be treated with a regenerative medicine approach. So super important that if you're getting platelet-rich plasma, you're not just getting that dumped into the knee joint. You need to treat all those layers. That's how you get a better response as well. The next issue is you need to have a comprehensive approach. And what that means is The way physical therapists look at your knee problem is they want to treat above and below the chain. And what that specifically means is there's that old school saying that the knee bone is connected to the ankle bone, the knee bone is connected to the hip bone, which is connected to the backbone. In some very kind of strange way, that is really how the body works. If your ankle is slightly unstable, that'll put more stress on the knee. If you have a slight pinched nerve in the lower back, that's going to throw off some of the muscle strength around the leg as well. That'll stress the knee more as well. You need to treat those areas above and below, not only with the right strengthening physical therapy biomechanical approach, but you should also treat them with the right regenerative medicine approach as well. So if someone's got knee pain and they have a slightly unstable ankle, you want to treat the ligaments of the ankle as well to help create a bit more stability, which in turn will put a little bit less stress on the knee as well. And that makes a difference. So super important to have that comprehensive approach. And then the last principle I want to mention is always use your own cells versus someone else's. You may hear people say, well, if you're older, if you've got medical issues, if you're on medications, shouldn't you use someone else's cells? Besides the fact that there are actual regulatory and legal issues with that, the reality is that there's no evidence that utilizing someone else's cells is better than utilizing your own. In fact, your body is made to respond to your own cells. It's made to push back and defend itself against someone else's cells. Utilize your own cells. The evidence suggests that you're better off or adequately treated by utilizing your own cells. And there's no evidence that you're better off using someone else's cells. And theoretically, you eliminate so many of those other risks that are associated with using someone else's cells. It really is just a sensible approach to stick to your own cells. Okay, so let's get to a few specific situations that I think are useful to learn from when it comes to knee pain. So the first one, most common one, is obviously knee arthritis. About a large percentage of the world seems to have knee arthritis, especially in my clinic. And if you failed physical therapy, strengthening exercises, supplements, the next step in my clinic is to then consider something like platelet-rich plasma. The evidence shows that platelet-rich plasma is a better injection option for knee pain at the 6 and 12-month mark as compared to the gel injections, the hyaluronic acid injections. It's a better option. And that's for a few reasons. Number one, you can treat the inflammation, you can treat the pain, and you can treat the instability. That's why it's a better option. So the way I would look at someone who has knee arthritis is, all right, where is the pain coming from? From the arthritic component. You treat that with a very high concentration of platelets, anywhere from 14 to 20 times your normal concentration. You can only really get that level of concentration if you have a flexible lab-based approach. Number two, I then look at, well, how does the ligament look over that? How does the medial collateral ligament look over that? Let's make sure we strengthen that. How do the tendons look around that as well? Is there any evidence that they've been dinged up over time? Let's make sure we're strengthening those as well, because that may be a pain generator and a stability issue as well. In addition, if you have any evidence of chronic strain in the peripheral nerves and fascial levels, we can then also do what's called neuroprolotherapy, where we're injecting a low concentration of dextrose or sugar water around the nerve to take some of the stress off, or even injecting platelet lysate, which is a growth factor from the platelets around the nerves as well. Helpful for pain relief as well. That's a very nuanced, comprehensive approach to treating knee arthritis. Not to mention, again, if they have an ankle or back issue, make sure that's addressed as well. And if needed, we can utilize platelet-rich plasma to treat those issues as well. Second example would be a knee tendon injury. So probably a good example would be if you have runner or jumper's knee. If you have tendinitis or inflammation or chronic irritation to the quadriceps tendon or the patellar tendon. Again, if you're failing strictly eccentric exercises, physical therapy, worthwhile to utilize platelet-rich plasma. In this case, I would utilize a moderate level of platelet-rich plasma, let's say 7 to 10 times your normal concentration of platelets. That's lower than what you would utilize for the joints. You don't need to be quite as aggressive there. Inject that into the tendon that's been injured, specifically where there's irritation or damage to the tendon. Inject that into the tendon sheath as well. And then I'd also want to know, why is there stress on that tendon? Is there evidence that the patella, the kneecap, is unstable? And if so, how do we treat that? We'd utilize a lower concentration of platelets to inject that into the ligaments around the kneecap to help create a little bit more stability to then take stress off the tendons as well. Last example, a knee ligament injury. So an interesting one would be a ACL injury, a anterior cruciate ligament injury. So this is a great example because, number one, you hear about ACL injuries so often now with athletes. But what's interesting is if you examine enough patients who have chronic knee arthritis or look at MRIs of patients that have chronic knee problems, you'll find subtle strain findings and subtle laxity in the ACL in a lot of these people, meaning they've probably injured that ligament at some point during some activity, and that slight injury over time on a daily basis with every step can create instability that can eventually lead to other types of knee problems, whether that's knee arthritis or other issues. Traditionally, the only real treatment option for an ACL injury would be if your ligament was totally blown apart to have it surgically reattached. But with very high level X-ray guidance, fluoroscopic guidance, you can deliver your own cells, platelet-rich plasma, into the two bands of the ACL ligament at the tibial insertion, at the bottom of the knee insertion. And you can then, under very high level X-ray guidance, even go deeper and higher into the knee and inject it right at the origin as well. In the right candidate, that can help to strengthen the ligaments, create more stability, give a better functional outcome, and because the ligament is stronger, possibly even prevent to the progression of arthritis. In that same sort of patient, if they've had a recent injury, you would then want to look at the knee, look at the imaging, and then treat any other structures that need to be treated. And so that would include maybe the medial collateral ligament, maybe the medial meniscus, with different levels of platelet-rich plasma as well. It's a really great example of where somebody might have one problem, but if you take that comprehensive 360 approach, you can then treat everything to it and then give somebody a stronger functional unit, better pain relief, better functional improvement as well long term. I hope this has given a sense of what is possible with platelet-rich plasma. As a treatment option for knee arthritis, I think it's great, in large part because it has the potential to treat a lot of different issues in a safe and very targeted fashion. And because you can treat multiple issues at one time, which is sometimes hard if you don't have enough cells. But with platelets and blood, you do. Platelet-rich plasma, I think, is a great first-line regenerative medicine treatment option for knee problems. And I hope you have a better understanding of how we're utilizing it and what are really high-level understanding of what your physician should be doing correctly and what you should be looking out for. And I hope this gives you some hope and understanding of how much more we can do for patients if you failed conservative options. Going forward, I'd love to hear your thoughts if you found this interesting and valuable. You can leave me more ideas of what else you'd like to hear about. My goal is to start offering this on a more regular basis, maybe every week or 2 weeks on different topics. If you're interested in learning more about what we're offering, you can subscribe to my email newsletter. You can stay connected with us on any of our social media channels as well. And connect with me if you'd like to learn more or would just like to communicate. Thank you for your time. Have a good day and live well. Bye-bye.